If you're a Canadian veteran, there's a decent chance you're leaving money, services, or support on the table, not because you don't deserve it, but because the system is complicated, the names are confusing, and the process is exhausting when you're already dealing with life after release. In this video, I'll cover the VAC benefits and supports that get missed the most, what they're for, and a quick checklist to help you decide what's worth looking into. Quick note, this is general information, not legal or medical advice. Programs can change. If you're in crisis, call 988 in Canada or local emergency services. Here's why benefits get missed. People assume one approval covers everything. They don't realize there are multiple layers. They stop after a denial even when an application can be improved with stronger evidence, and they don't realize some supports are tied to daily function, like help at home, not just a diagnosis. First, disability benefits, often paid through pain and suffering compensation. This is compensation for service-related injury or illness impacts on your life. Two common misses are assuming it only applies to obvious injuries, or applying once and never revisiting it when symptoms worsen, or a condition changes. Rates and options can change, so always check the current VAC information. Second, rehabilitation services and the income replacement benefit, often called IRB. This gets missed because people assume that once they're released, they're on their own financially. IRB is meant to support income while you participate in rehabilitation and rebuild stability. If your transition has been rough, work, health, or retraining, rehab and IRB are worth a serious look. Third, additional pain and suffering compensation, or APSC. This can apply when a severe and permanent service-related disability creates an ongoing barrier to life after service. It's often missed because veterans think the first disability decision is the end of the road. Fourth, treatment benefits. This is VAC health coverage that can help with things like prescriptions, therapy, and certain supports when they're tied to approved conditions. It's missed because people focus only on compensation payments, but coverage can be just as important. If you're paying out of pocket for treatment connected to an approved condition, it's worth checking what coverage may be available. Fifth, the caregiver recognition benefit. If a spouse or family member is providing ongoing support so you can function at home, VAC may recognize that role through a tax-free monthly benefit paid to the caregiver. This gets missed because many veterans don't label their situation as needing care, even when daily support is happening behind the scenes. The rate can change over time, so check the current VAC details. Sixth, the Veterans Independence Program, or VIP. This is a major quality of life support that often gets missed because it doesn't sound like a payment. VIP can fund practical help at home, things like housekeeping, grounds maintenance, meal preparation, and personal care supports. If your condition makes daily tasks harder, even if you're pushing through, VIP is worth understanding. Seventh, the Education and Training Benefit, ETB, plus Career Transition Services. This is missed because veterans assume they're too old, already employed, or missed their chance. ETB can help fund education and training, and the amount depends on service. Career Transition Services can help you choose a realistic path that fits your situation. Here's a quick checklist. It's worth reviewing your situation if your service-related symptoms have worsened, you're paying out of pocket for treatment that might connect to approved conditions, your transition has been unstable in work, health, housing, or finances, someone at home provides daily support, home tasks are getting harder to keep up with, or education and retraining costs are a barrier. Best next step, use the official VAC program pages for the benefits that match your situation and compare them to where you are right now. In the description, I include the official program names, a simple checklist, and a last reviewed date so you know how current the info is. No pressure to do everything at once. Pick the one or two supports that would improve stability the most and start there. This is the Drill Hall Canada, practical Canada-only transition information, organized and kept current. If this helped, subscribe for more. Like it, and share it with a veteran who needs it. Sources and the last reviewed date are in the description. Subscribe, like, share. General info, not legal medical advice. Crisis line, 988, Canada.